Hi, Dr. TJ Miller here. Today we're going to talk about floss. The floss that we like to use is a product from gum, and they call this an expanding floss. Get a piece about that long. And what you're going to do, grab it at the ends, and you're going to wrap it on your middle fingers, like that. Then you'll use your index fingers, thumbs, or combinations to adapt the floss with maybe about that much distance between your fingers. You can do a far better job adapting the floss around the teeth if you do it if you wrap it this way on your middle fingers versus wrapping it on your index fingers. So get about that much distance. The only time that you go in between the teeth side to side is like that. We don't want you to do any seesawing or polishing like that below the gum line. So the only time side to side is just to get between the contact point. Then you're going to make a C around the tooth, cheek side and tongue side. We don't like to see L's or I's like that. We want to see a C. And what you're going to do is you're going to keep the floss adapted on one tooth and floss that one up and down, keeping it parallel to the gum line. We do not want you to cross over like that because you'll lacerate through the attachment below the gum line and potentially create some problems. So make your C up and down 5 times, wrap it to the next tooth. So you're up and down 5 times. And then you move forward or backwards. Let's say we're going to go backwards. Now, this spot does not have a contact point between the two teeth, so it's going to pop out more. And for those of you who have open contacts, you just need to keep the floss adapted, maybe do a smaller throw in between coming down below the gum line. Bring it forward again, making your C. Okay, and these also might be spaces where you could use an interproximal brush. So then if we're coming forward, here's a contact point. Again, make your C up and down 5 times. Wrap it again to the adjacent tooth. You're cleaning each tooth separately. Again, the C technique, so you're keeping the floss at the gum line. So you're not crossing over like that. All right. Now, as far as types of floss out there, I'm not a big fan of the non-shredding flosses. The non-shredding flosses are made from a material that's exceedingly slick, produces very little friction. If that is the only option you have, because maybe you've got some restorations that are old that shred floss, fillings or crowns, so in that situation, you would come in and instead of going up and down 5 times, you probably have to go up and down about 10 to 15 times to create enough space, enough friction to get rid of that bacteria that's below the gum line and on the side of the tooth. So that would be my recommendation. Anything other than a non-shredding floss. The non-shredding flosses, I just don't think they clean that well. That's it. Have a good day.